Medications form the foundation of bipolar treatment, but medications alone are not always sufficient to keep patients well over the longer term. A combination of medication, psychotherapy, and lifestyle changes are all important in order to stay well when living with bipolar disorder. It's important for patients to take charge of their lives by gaining knowledge about the condition, learning stress reduction strategies, monitoring for early signs of relapse, and enlisting family and other supports. Minimizing stress, getting adequate sleep, and avoiding street drugs are all important steps you can take to help prevent a relapse.
It isn't that you take some medication and wake up the next day and you're okay. It's not that kind of illness. The medication helps. It helps, obviously, with the chemistry in my brain, but I have a lot of work to do, too, on me as a person to get myself out of the kinds of behaviors that added to the illness.
It is very clear that people with this illness do best when they get both a medical treatment, a medication of some sort, and some non-medical treatment, a psychological treatment, counseling or therapy or rehab, call it whatever you want, but people need both. So the medicines are used to prevent episodes, mood episodes, from coming back. Now, on the other hand, what psychotherapy does is it helps people learn about how to manage the leftover symptoms. Now, the other thing psychotherapy does is it accelerates recovery. It helps people learn about how to manage the symptoms of the illness. And number two, it helps them put their life back together.
Sleep is important, diet is important, your support network of people is important. So tried to focus on that. A lot of those things sound very simple. They are not very simple, you know. Another wellness strategy is making sure you have some downtime. Come home, take time for yourself, de-stress from that, then you're going to be able to go to sleep and be ready to do the next day. I learned about positive self-talk, which is learning that how you think is going to affect how you feel. And I really believe that was a big change for me.
Staying shut in, that's not very good. You need a support group of some kind, and be good to your friends. You're gonna need them. They're the first one who's gonna give you some ends if you start going off.
Journaling is like a good something you can do, like when you're like feeling alone or whatever.
Avoiding stress, and that's situations and people who are negative. Avoid that. I go exercise, I go swimming, find an interest, I go to pottery. Those things are very important to me now. Do things that you enjoy doing, find what they are. These illnesses, not only are they sneaky, but they also have a tremendous impact on your family, the people around you, your friends. They don't know what to do. They would like desperately to help you, but they don't know what it is they should do.
Because the patient needs the help of somebody around him that he trusts in terms of their willingness to contribute to his well-being. Things like reminding the patient, oh, you shouldn't drink because this will interfere with the quality of your sleep or will release your impulses. And when you were well, you asked me to remind you of this because of the trouble that you had before.
The role of the family in the management of bipolar disorder is critical. There's pretty good evidence that integrating families into the management plans of people who have bipolar disorder improves outcomes.
We strongly encourage family members to get involved in providing support for somebody that has a bipolar disorder. They know that they need to keep an eye on the person in terms of any behavioral changes, but also they need to be aware that they can't be too intrusive about it. The family members need to understand that this is a normal person like anybody else. So unless they are seeing 2 or 3 other changes in terms of their behavior, you don't want the relative to be going and saying to the person, "You've done that, so let's go and see the doctor."
In my family, I think it's brought us kind of closer together, certainly my dad and I. We always had a kind of relationship with a lot of friction before, and when I got sick, it was like the bond got a lot stronger.
It's the unconditional support I had from my husband, who said, whatever it is, whatever's going on, I'm there.
I'm very optimistic.
Having bipolar disorder can be a very empowering and positive thing if you choose to make it so, because it's a struggle that you need to overcome for yourself. It makes you a stronger person, better person. You can use it to help other people. It certainly hasn't stopped me from doing anything that I want. I think it's a privilege to have to learn to take care of yourself, because a lot of people don't have to go through that, and I know I'm stronger from that. And it's not something to be embarrassed or worried about. I don't like that word illness, really. I have bipolar disorder, but I'm well because I work hard to be well. You know, it's like, all right, you make a choice. So I think I've got mental wellness, for sure.